My name is Leslie Frederick, and I work for the Division of Specialized Care for Children, dscc. In this presentation, we'll focus on dscc Care Coordination Services, how dscc Care Coordination teams help families, and the roles care coordinators play in helping families. Care coordination is available to any family willing to fill out an application and whose child has an eligible medical condition. First, let's consider why care coordination is needed. Why was it decided that this can be a good thing for families? Care coordination is needed because families of children with special needs require multiple services from an array of providers. Services can be uncoordinated and fragmented. Families often need a link to and between these services. And families of children with special needs often need services to meet more than just a medical need. Care coordination is needed also because programs operate under different rules and eligibility requirements, and that can result in gaps or an overlap in services. The system of care for children and families is confusing to both those needing services and those providing services. Healthcare resources are limited and insufficient to meet all needs. And some parents just can't do it all by themselves. Care coordination can be a very valuable service for many families, especially those that have a child who has been newly diagnosed, has multiple health impairments and requires many appointments, or families that just have complex family issues. At dscc, each family is assigned a care coordination team, a care coordinator, and a program care coordinator assistant that will help them get the services that they need. Care coordinators are either a speech-language pathologist or audiologist, a nurse, or medical social worker. Each office employs staff from all of these disciplines. The PCA, or Program Care Coordinator Assistant, acts as an assistant to the care coordinator, and he or she is an intake worker who opens the records on new referrals, and both individuals communicate with families and assist families in getting the services they need in the medical treatment for their child. Next, let's look at various other agencies and providers that may also be a part of the team providing services to families. dscc communicates and shares information with all of these partners on behalf of the family. Some of our families are dealing with other government agencies, specialists, teams, and centers. They may have some issues that they need help with concerning schools and educational programs, because many of our children who have chronic health impairments often are at risk for educational delays. They may be dealing with other community agencies like Public Health, DCFS, or Department of Rehab Services. Of course, the primary care physician, or PCP, is also an integral part of the team working with the family. And some families may also have some social supports that they are in need of. dscc staff network with all of these agencies and resources in order to keep up to date on services they provide, and also to keep other agencies aware of what dscc does. Next, I would like to talk about some essential characteristics of our care coordinators. Our care coordinators should be managing care proactively, in other words, looking ahead and following up to make sure families are aware of dates of return to all of the specialists providing care to their children, educating and preparing families for future transitions. Another thing our care coordinators can do is to provide anticipatory guidance to avoid pitfalls in the future and help families plan for the future. This involves providing information to families about all kinds of topics such as emergency preparedness, ways to teach children to be independent and build self-esteem, ways to improve oral health and toothbrushing, helping families organize their child's medical information, bills, and EOBs, things like that. Not all families may be interested in or need some of this information, but our staff are to offer this to any families who are interested. Another thing care coordinators do is to provide follow-up and monitoring, making sure families and children actually get the services that they choose. And if they're not, trying to find out what the barriers are and helping remove them. In the next few slides, I'd like to just give you some examples of the information, the kinds of information that we can offer families. As stated previously, dscc staff communicate and share information with all of the others that are working with the child and family. And they sometimes serve as just a point person for communication with other providers, making it easier for everybody to know what each other's roles are. Another thing that our care coordination teams can do is to just foster connections among families and encourage family-to-family support. Our staff are in a good position to offer parents information about parent support groups and to link one parent with another parent who has a child with a similar medical condition. Sometimes we can link families to diagnosis-related groups, such as organizations that are through the National Organization for Rare Diseases, or NORD, through Illinois parent-to-parent support groups such as Guide by Your Side. And I think information provision is one of the most valuable assets dscc has to offer parents. We have family-friendly, trustworthy websites that we can give, tip sheets and transition tools to help parents and youth use when planning for the future. We give them phone numbers and addresses and tell them about the services offered by other programs and help them get publications that are specific to the various diagnoses for families that are in need of it. Another role dscc care coordinators play is just facilitator, helping families link to services and making sure the services occur as seamlessly as possible. That might include arranging appointments, sharing information about all kids, helping them fill out applications. An advocate. Our care coordinators are sometimes a strong advocate for our families when needed, obtaining funding from outside sources or helping families advocate in their IEP or ISSP meetings. We do a family survey at dscc every 5 years to just check with our families and see how they're benefiting from care coordination services. And through the survey, we find that educational issues are very common among our families. So an important role our staff play is in providing families with the educational rights booklet, helping them interpret it, our staff can attend an IEP or ISSP meeting with a family if they want. Our staff offer tips to families to help them advocate for educational services, just little tips like taking the child's picture to the IEP meeting, bringing their educational rights booklet with them to the meeting, knowing ahead of time what their child's strengths and needs are, and what services they want to advocate for. Another role care coordinators play in the lives of families is that of a teacher or enabler, helping families become self-sufficient and independent when possible. Our staff should know when to jump in and be more direct in providing assistance when families are in crisis, such as when a child receives another diagnosis or dad loses his job or maybe there's a divorce going on, or just having to change insurance and get used to new providers. These are times when families may be in crisis, and at that time, care coordinators can be more directly involved in arranging appointments for the family, trying to get all the appointments on one day, whatever helps. Next role I want to talk about is that of collaborator. Already kind of talked about how our staff partner with families as equals in problem solving and planning. Sometimes our staff plays the role of just a support person, just being there to listen when a family needs to talk. Our families also deal with a number of other agencies, So sometimes our staff act as just a liaison, working between the family and the other agencies to help the family understand the rules and policies so that we don't have a lot of multiple agencies working at cross purposes. Kind of a point person. Our staff are also a systems builder in that we are always trying to advocate for children with special needs by participating on a lot of interagency committees to bring to the table the needs of children with special health care. Okay, next slide, I want to talk about how care coordination is done as far as the process. There's 4 stages. The first stage is called assessment. And this is a really important stage. This is the listening and information gathering stage. This is when we get to know the family, find out what's needed. We have a special form to do that with. It has a lot of topics on it that our staff will talk through just to find out what the needs are. The second stage is planning, taking the assessment information, determining what resources might help, and developing a plan to address the needs that we identified while interviewing the family. The third stage would be the implementation stage. In other words, just putting the plan into action, making things happen. And the last stage would be monitoring the plan, evaluating and reassessing things, determining how the plan's working, making any adjustments, finding if there's new needs. We want to ask the family, are the services you're receiving beneficial? Are the services beneficial in the opinion of the providers? Are they appropriate? And are they delivered in a timely fashion? Going back to assessment, a few things more about that would be that assessment is done in a variety of ways, face-to-face visits, phone calls with the family, securing releases and getting medical reports, IEPs and IFSPs for the record that we develop on the child in the office, organizing and reviewing that information, and then identifying the needs with the family. Remember, you may remember that I mentioned that there's a form that we use when we're interviewing families. It's called the assessment worksheet, but it has a lot of topics on it, and that form is used as just a guide for asking questions and finding out what the family needs. Based on the information obtained during the interview, the plan is developed and resources are provided to the family. Sometimes the care coordinator will go back to the office and do some more research to make sure that there's not some other resources that we want to offer and contact the family later to offer some more information. A copy of the plan is mailed to the family and others who the family is willing to share it with. Okay, I said earlier that we offer anticipatory guidance, tip sheets and transition tools, and an information about an array of topics for families that they may be interested in learning about. Some of the things we may talk about is the medical and health issues. We may want to offer information about the Epilepsy Foundation if it's a child with a seizure disorder, or United Cerebral Palsy if it's a child with CP, Illinois Assistive Technology Project, Autism Speaks. We've even offered a couple of websites that are really good websites for people that are interested in purchasing a used conversion van. So all kinds of information that may be beneficial. We can help families with transportation issues, finding out if they're eligible for SSI, food stamps, or all kids. Kind of a good story that I can tell you about how our care coordinators are able to think outside the box sometimes is a family in the southern part of the state lives out away from any public transportation. They had to drive 2 hours to get to St. Louis Children's for their child's medical care, and their car had broken down. So the care coordinator made a lot of phone calls and found a retired mechanic in the community who was willing to fix the car for the price of just the parts. So that worked out really nicely. Some of the other information that we can offer families would be about child care resources like Illinois Child Care Resource and Referral, talking to families about how they're coping with sibling issues. We have a sibling booklet that we can give to families to work through with their other children. We also have a coordinated care organizer, which would be a nice file that the family can organize medical information, bills, medical summaries, and things like that. We also want to make sure we don't ignore the social or recreational needs of youth and children with special health care needs. So we talk to them about YMCA, YWCA, park and community resources for recreation. Another kind of a nice story is that we had a family who had a child in a wheelchair, had cerebral palsy, and mother and her son liked to bowl. And so we were able to purchase a bowling ramp from our gift funds, and the child could participate in bowling. It's a ramp where the person can put the bowling ball at the top, let it go, and it just rolls down and down the end of the ramp and down the alley. And the mother sent a picture of she and her son and their bowling score. Okay, so a couple of the other topics on that assessment worksheet that we talked through at the early interviews with families would be to talk about the educational program, make sure the family has gotten their child linked to an appropriate program such as EI, early childhood, special ed, speech, that kind of thing. Two other important areas that are a part of dscc care coordination would be the medical home and transition. I want to talk a little bit more about those next. You have probably heard the term medical home. Medical home is just a term to describe the kind of relationship all children and families should have with their primary care physician, especially children with special health care needs. It's really about how a practice provides care to patients. Care coordination teams work to enhance the relationship between families and their primary care physician. So we often, when talking to families, we'll ask them questions about, such as, is your child's primary care physician there for you when you need to talk? Does your primary care physician provide you with information and referrals to other resources when you need it? And does your primary care physician treat you as an equal partner, respect your right to ask questions and make decisions? That would be a medical home, and I hope that you all feel that you have a medical home relationship with your PCC. Next, I'd like to talk about transitioning to adulthood, and that is one of the most challenging changes for youth and their families. So special planning is often needed. And really, helping families learn to let go is often the first step. Helping families and youth learn how to become self-sufficient, at least as far as they can go, take themselves as far as they can go. Transition means helping families and youth learn about what the educational opportunities are for the older child, youth, finding out what the social and recreational opportunities are in the community, finances, living arrangements. Some children and youth with special needs may choose to live at home for the rest of their lives, but there are other living arrangement opportunities out there that families need to know about. Employment and how to go about finding appropriate employment, and of course self-care and medical care. So these are all areas that we work with our youth and families in learning more about. There's a Healthy and Ready to Work National Center that we tell families about to do with the transition information that we provide. This is a great website to help learn about healthy routines, wellness, prevention. It has insurance guides and tip sheets in it, and information about how to determine what kind of accommodations might be needed in the workplace or in a college setting. These are just a few of the things that you can find posted on the DSCC website. Let me give you our website address. That's www.uic.edu/ hsc/dscc. Other areas of transition to talk about with our families would be the Department of Rehabilitation Services and the services that they can offer, employment and training centers, guardianship and advocacy, family voices, centers for independent living. There are many support groups that are wonderful in Illinois, Illinois Hands and Voices, Family Voices, Guide by Your Side, to name just a few. And, of course, the social recreational activities in communities such as YMCA, summer camps, park district opportunities. And you can read more about those also on our DSCC Internet. So that's pretty much all I have to try to explain to you about DSCC. If you have any questions at all, please be sure to call your local DSCC office. If you would like one of our staff to come to your office location and do an in-service about DSCC or to answer questions and meet your staff or whoever you serve, please be sure to call and ask for that. They would be happy to do that. Thank you.